So hello everyone again. My name is Savannah Haverson. I'm the Community Relations Representative at University House Issaquah. Before we start today's presentation, I just want to share a couple details about the beautiful University House Issaquah. So we are a premier retirement community and we're nestled right in the foothills of the Cascade Mountains. And so our residents enjoy the small town charm of Issaquah and the inspiring views of nature, all while still being close to the bustling city centers of Seattle and Bellevue. Our residents share a passion for knowledge, art, and culture, and a desire to stay active in mind, body, and spirit. At University House Issaquah, we are devoted to promoting healthy living through a wealth of programming, fine dining in our Chinook dining room, and an energetic, friendly atmosphere. So if you're interested in learning more, our community relations team would be happy to answer any questions that you have or invite you in for a tour of the community. You can reach us at 425-557-4200. All right, and now we'll go on to our main event. We are honored to host Dr. Brad Lichtenstein, who will be presenting on mind-body solutions for pain management. So Dr. Brad is a licensed neuropathic physician in private practice and a professor at Bastyr University. He serves as an attending physician for the Mind-Body Medicine Biofeedback Clinics at the Bastyr Center for Natural Health and has a strong clinical and teaching focus on developing psycho-emotional and spiritual health while dealing with chronic life-changing illnesses. And now I'll turn it over to Dr. Brad.
Hi, everyone. I hope you all can hear me. You can all hear me. Okay, great. Thank you. So just to clarify, that's naturopathic physician. I'm a naturopathic physician, just for clarity's sake. So before we start, I always like to ask when I start these things, if there are, to find out a little bit more about you guys that are here, what are you hoping to hear about? Is there anything that you have questions about so I can design how I flow through this talk? If there is any specific thing like, oh, I wanted to hear about this, or this is one of the main concerns I have, if you wouldn't mind putting that in the chat box at the moment, because that could help with the flow of this conversation. If not, no worries. I can just go with the presentation. Just going to give you a second there. And at any time throughout this, if there's a question at any time, please put something in the chat box. Savannah, you can let me know if there's something that comes up, so that, you know, I want to make sure that this can be as interactive as possible over this medium. So I do have some slides. I might jump around a little bit about that. Ooh. I'd like my mind to intercept the pain and alternatives to opioids. Okay. Yeah, we will talk some about that. Thank you. Anything else at the moment? Okay, let me share my screen now. So we're here, we're going to talk about mind, body. I know I put the word solutions to pain and pain management. So well, that worked really well. I stopped sharing my screen. Let's try that one more time. Okay. There we go. Oh, that's why. I know why that happened. I was on my last slide. Somebody who's done this so many times, right? Okay. So I always like to start with some quotes because I think it speaks to some of the stuff that we're talking about here. Nature has placed mankind under the governance of two sovereign masters, pain and pleasure. And isn't that true? I mean, it's that idea of pain and pleasure. The pleasure, we'll try to do whatever we can to keep it going. And then the pain, we try to get rid of everything. And we'll talk more about that when it comes to chronic pain as well. Now, I share this quote with my students a lot. doctors think a lot of patients are cured who simply give up in disgust, who quit in disgust. And a lot of times my student clinicians that I work with will go, well, see, they're better. They didn't come back. So pain, what is pain? Usually when we think of pain, we think of it as punishment, something bad, something unpleasant. And the word pain does come from that word penalty. But what is the purpose of pain? We could say it's to keep us humble. No, but I'm not going to think of it that. If we think about what pain is, it really is about protection. If we did not have pain, we would continue to do certain things that might harm ourselves. So if you twist your ankle and you feel the pain, it's going to prevent you from continuing to walk on that ankle, and so that it can get attention. So if we start to think of pain not as a penalty, but something to help protect us, we might be able to develop a different relationship with pain. And the International Association for the Study of Pain has a definition. And if we look at the definition, we get into the issues of what pain are. As that comic strip, if you can't see it, there's a comic here from the Far Side that says, wait a minute, Mr. Crumbly, maybe it isn't a kidney stone after all. And there's a rhinoceros horn in the back of someone's back. So the definition of pain, it's an unpleasant sensory and emotional experience associated with an actual or potential tissue damage. And when we describe it, it's always subjective because there's no measurement to say, oh, you're actually having pain. So it's an actual or potential tissue damage. And unquestionably, there is a sensation in a part of the body that we deem pleasant or unpleasant here in this specifics. So as you can see from this definition, there's something that's emotional, that it's sensory, that there is some damage or potential damage, but it's always subjective. So it's hard to talk to someone, a provider, about the pain. So there's another cartoon here. It's the doctor's extending someone's leg and says, really? Everyone says it hurts when I do that. Let me try it again. What we're talking about here from a brain perspective, from a neurological perspective, is something called interoception. Interoception is how we make sense of the world, but interoception is about our internal world. It's everything under the skin. It's how our body senses itself. So some interoceptive examples would be nausea, hunger, but also what you feel in your joints, what you feel in your muscles. It's those sensations that are under the skin, and they send a signal back to the brain. When we talk about the five senses, sight, smell, taste, touch, and hearing. Thank you, Jody, put your hand on the ear. Those are outside the body. They come into the body, right? So light hits my retina and it comes outside. So I know how to make sense of the outside world. But when we talk about pain, it's the sensations from the inside of the body that are going up to the brain. So when we talk about the five senses outside of us, that's called exteroception. What we're talking about with pain is it's an interoceptive response. Not that you need to remember those words so much, but just remember that the brain is always getting information from the world, either the world inside us or outside us. So from what I'm saying here, pain is an unpleasant experience. We call it unpleasant. But as I said in that original definition, it could be potential or actual tissue damage. It's a sensory thing, interoception, sensory. It alerts the brain that something's happening, and then you perceive it. And as a result of perceiving it, your body generates a response. Notice I said your body generates a response. It's not that you intentionally do anything, right? Put your hand on a hot stove. You pull your hand away before your conscious brain, your left lateral cortex says, oh, that's hot, I should move it away. That's important. People who do not have a sense of touch, who have numbness to a certain area, would put their hand on the flame and they wouldn't move it away because that sensation, that signal doesn't go up to the brain. So that's important in thinking about our concept of pain because pain is an aspect of consciousness. Without consciousness, we don't have pain. Before I go on, just this aspect here. This is why we have anesthesia. During surgery, and you're having surgery, you could have, your abdomen cut open or open heart surgery. Those signals still fire to the brain, but because the parts of the brain that aren't conscious aren't alert, you don't feel the pain. Now, when we talk about mind-body interventions, that gives us a clue. Now, that doesn't mean just drug ourselves so we don't feel the pain. That's what conventional medical doctors will do. But that speaks to it. So going back to this is a diagram. If you're on the phone, you don't see this, but there's a diagram, there's a finger, and there's a stimulus, and it sends a signal to the spine. The spine goes back up to the brain. We can experience no pain. There is no pain until that signal reaches our brain, even if we damage our finger. So pain is a creation of the brain, and it may or may not be even associated with, the word here is nociceptive, a painful trigger. What's the take home? You could have damage to your finger, nociception, but not feel pain. And you can feel pain without having damage to your finger. So that's really important. The problem, because all of this is sensory, no one can really tell you what your experience is. And how many times have you gone to doctors and say, well, it's not real. You can't be. I've heard this. Doctors say to people, it's like, well, you must not really be in pain. How the hell do they know? Excuse me. Sorry. How do they know? So just to reiterate, you could have tissue damage and no pain. You could have no tissue damage and pain. So tissue damage alone is neither sufficient nor necessary for you to have pain. It's really important. How much a person is in pain may not be related to the degree of pathology. So no provider can tell you you're making it up. That's your experience. This is just talking about time when we talk about pain. We could talk about acute pain. Usually it's about 3 months or less. And in acute pain, there's usually tissue damage. The interesting findings, though, with chronic pain research is it's usually longer than 3 months. Some people in pain management are getting even rid of this time frame. But what happens in chronic pain is there's usually not ongoing tissue damage or metabolic issues. Now, that's what the research suggests, that meaning people can have chronic pain, but there's really nothing left. But they'll go, but I hurt my back, or but I did damage my knee. But if you look at the damage, many orthopedic surgeons or some other pain management doctors will say, there's no real damage there. Now, the problem with that is how we determine tissue damage and inflammation. And as more and more research comes out about inflammation, they might not have had the ability to detect and assess that. So that's one thing to keep in mind. The other is we could still say, maybe there's no tissue damage. I did hurt my back. I injured it a while ago, but the muscles are better, but I still feel the pain. That happens for every one of us on the call. Even if I say, I don't really feel pain, we all experience this because pain is a construct of the brain. And this will make sense when we talk about mind-body techniques. So typically chronic pain, some estimates say up to 90% of chronic pain occurs in people who had resolution to the tissue damage. Please do not take from this, I'm saying you're making it up, because that's not it. Now, how many of you look at this image, if you are on this, you look at this image and you already feel pain? I do. Okay, I see some people shaking their head, but I look at this image and I feel pain in my body. I feel my body contract. The image, for those who are on the phone call, is there's a cut on the hand.
Oh, Brad, I don't think we're seeing the image. We're seeing a white screen right now.
Nothing?
No, not yet. There we are.
So you don't see anything here?
There we go. Now we see it.
Okay, I'm sorry. I saw some people shaking their heads. I thought you meant that you didn't feel pain. Do you see? So you see the cut on the hand? That's interesting. Thank you. Thank you. Please interrupt me and let me know. Now how many people see this and feel something in their body? Okay. Some people might see this and start to get, nauseous, or might feel the pain in your hand. Now that's an example of what we mean by pain is a construct of the brain. You see this image and your body responds. It makes a prediction about what is going to happen. It's not happening to you. You might be safe, but you already predict what's going to happen. And a number of networks in the brain, not just one area, start to fire. So I see that. So I tell this story all the time. I had a Ninja blender. If any of you know the Ninja blender, I used to make my smoothies, and I had a Ninja blender. And I had a white porcelain sink. And one day I was washing the Ninja blender, and I was looking at the sink and I was thinking about getting on with my day. And I noticed that my white sink was very, 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 very red. There was red all over it. And I kept thinking, wait a minute, I didn't put beets in my smoothie, and there's soapy water all over. And then I look down and I see that the red is coming from my finger that I sliced very deeply, and there's soap all over my hand. Up until then, I had not felt pain. The signal had to fire. There was no nerve conduction problem in my finger. It went up to my brain. I didn't register it. Then the minute I register it, I screamed out loud. Scared my spouse, came running down the stairs. It was like, but I screamed and it hurt and I felt the pain, but it didn't happen until I detected it. Again, this is important to know because it also speaks to how we might be able to work with pain. So pain, this is called a neurotag, meaning there's so many areas of the brain that are involved. My visual cortex, I saw the image, but not just my sensory cortex, but also the prediction cycle. If I have hurt myself before, if I cut myself before and I have a memory of it, then I can recreate it, just like any of us who look at this image and start to feel it. So here's another picture. I hope the picture changed. And there's thank you. I'm going to keep looking at you for that. So it's very, very wordy slide, but it just lists a bunch of different parts of the brain. The only thing I want you to take from this is when you feel pain, it's not just one area of your brain. It is your memory centers. It's your problem-solving areas. It's your sensation center. It's not just your sensation centers. It's everything else. So when you feel pain, it's a whole brain experience. So the Dalai Lama said in one of his books, I think it was The Art of Happiness, to lessen the suffering of pain, we need to make a crucial distinction between pain of pain, the pain of pain, the pain we feel with the pain, and the pain that we create about any thoughts of pain. Okay, that's going to be a clue here when we start to talk about these mind-body interventions to help regulate pain. So at this moment, if you do have any questions, I invite you to type them in. I'm going to keep going, but Savannah, you can interrupt me if there's somebody that types something in. So almost every talk I talk about mind-body medicine, every conversation I have about whether it's pain or emotional regulation or stress, I have to bring up this concept of hardiness because this is some clue about how we can manage or work with. I like to don't even say manage, but work with our pain. Hardiness is this concept that has 3 characteristics, or actually 4. The first one is something called commitment. Commitment is this idea that I am committed to my life. Now, that sounds like, well, what does that mean? Of course. Commitment is that when you have an issue, whether it's pain or any other chronic condition, that you don't identify yourself as only being that painful thing. I cannot tell you in the number of years I've been working with people, I've heard people say, well, I am just whatever diagnosis it is. I'm just IBS. I am just my pain. They've said that. I am just my pain. Pain is all I am. All I'm doing is working with my pain. The commitment aspect of resiliency or hardiness is that there's other aspects of your life. It could be whether you have, like in these images, a golf game, or you have a spiritual community, or you have friends, or you're a knitter. To change the focus from over-identification of one thing and to look at how there's other aspects of your life. People who can identify that have less pain, have greater hardiness. The second aspect of hardiness is challenge, that when something happens, they feel pain, for instance. They don't say, this is the worst thing in the world. The challenge parameters, they go, what now? Now, how many times do we have pain and we go, I can't do anything. This is the worst thing in the world. Instead of saying, now what? What now? These hardiness studies were originally done with individuals who, well, there were some original hardiness studies done with people who were losing their jobs. When Ma Bell broke up, if some of us remember Ma Bell, some people don't even know what Ma Bell was when I talk to my students that are 20. But when the phone company broke up and they lost their jobs, they found that people who were more resilient and hardy had this challenge parameter. Rather than say, oh my God, I don't have a job, that's it. They said, well, what now? Now, the third parameter is control. We might not be able to control what happens in our life. As we all can recognize, we couldn't control COVID, the environment, what things are happening. But the control parameters that we say, I am going to be an active participant in my life. I am going to be an active participant in my healthcare. I can adjust how I think about things. So these are all important skills, if you want to think about, to engage with these mind-body techniques. Now, in the original work of hardiness and resiliency, these were the 3 parameters. Then people came along and recognized there is one more, community. And this is one of the things that challenged us with COVID, all of us, right? That when we have a sense of community, people that we can talk to, the people that we can connect with, whether it's through Zoom, whether it's going and meeting people, when we have other people with whom we can connect, we're better able to have commitment, challenge, and control. And what we found, like with PTSD, with trauma, people who immediately reach out to others in their support network often don't develop PTSD after a traumatic event or a painful event. Okay, so that's hardiness. Now, going back to mind-body medicine and mind-body techniques. Remember in the definition of pain, I said that it is sensory and emotional. That there's a sensory component and an emotional component, however we define emotions. And what we're focusing on, as I said, that the brain, the whole brain is involved in pain. So there's 2 broad ways of working with our pain. We can regulate our attention, what we focus on, or we can change our mood and affect. So all of the mind-body techniques I'm about to talk about fall into either attentional modulation or emotional modulation. And attentional modulation, in the psychology research, they say distraction. I don't like the word distraction because from a neuroscience perspective, I might not be focusing on my pain, but I'm focusing on something else. So when we talk about attentional modulation with pain, if I focus on something else, I might not decrease the intensity of my pain, or I might decrease the intensity of the pain. I might not, it won't feel as intense, but I might still feel the disturbance. I can also change my mood, and we're going to talk about how, and that might not change the disturbance. The disturbance is there, but the disturbance changes. It's less upsetting to me, but the intensity stays the same. This will make sense in a moment. So emotions and pain become a rehearsal. Like I said, if you saw that image of that cut on the hand and you started to feel something in your body, you felt pain, it's because we're rehearsing things. So one of the things I want to ask you is like, how painful would it be? This is an old scale that they ask people on a scale of 1 to 10, just to think of this situation. You bump your shin badly on an edge of a coffee table. How painful would it be? Do you already feel the pain? Imagine you burn your tongue on a very hot drink. Do you feel it? How painful would it be? 0 to 10. Your muscles are sore after some physical activity. You did some yard work or did some laundry. Imagine you trap your finger in a drawer. Are you feeling what is happening in your body? Are you able to notice? Some of you might go, I'm not even thinking anything. Nothing's coming up for me. I got sunburn on my shoulders, nothing. Or I fell off my bicycle. And so I'm just giving these because the more painful you find these examples that aren't happening in this moment to be, the more likely you rehearse pain. Now, this is not blaming. It's just that our brain is always trying to predict something so that we can keep ourselves safe. So this talks about our pain narratives. What do we tell ourselves about pain? Some of us say, like someday there's going to be a breakthrough and this pain they'll cure my pain. Or I just haven't found the right doctor, protocol, acupuncturist yet. Some people say, I wish people could see that I was in pain so they wouldn't ask me to do this work for them. I don't dare go outside and do things because then people won't think I'm really sick or in pain. I can't go and do that because then all of this, and even one more, the PT told me that the cause of my pain was I was lifting. So I don't want to do that now. These are narratives that we have about the pain. And as we say these things over and over to ourselves, we wind up activating all those parts of the brain. And one argument can be that the brain then keeps the pain going. Again, in no way do I want you to leave here thinking I'm saying you're making up the pain. It's not. So let's just think about this for a second. If you look at the screen, you don't have to. A crowded waiting room. Well, none of us have been in a crowded waiting. I don't think we've been in a crowded waiting room. Some of us might go, "Oh, a crowded waiting room. I want to get back to a crowded waiting room." But traffic. Haven't been in traffic. Or think about your insurance or invoices. When you think of these things, your body already responds. Now, I remember working with somebody in the pain clinic at Bastyr once, and I said something about traffic, and she goes, "I love traffic." I said, "Really?" That was news to me. She goes, "Well, I love traffic because I can't get home to my kids, I can't get home to my husband, and I get to listen to my audiobooks for as long as I want." I'm like, whoa, I never thought of it that way. But see, we all react to these situations with a narrative, and that narrative keeps us stuck. Okay? So up until now, I'm setting the framework. We think of something, we think of our pain, we even think of our pain, and our body starts to respond. Now I want you to imagine one of these here. I want you to imagine you're on an all expense paid trip by me, COVID-free, no one with any tropical diseases around. nothing. Nice beach, great weather, no risk of anything, hurricanes, and then you're there on the beach and it's nice and warm, not too hot. Okay, now let's take it a step further. And then I give you this fresh lemon. I just picked it from a tree right near the beach. And you cut into that lemon and you put a drop on your tongue. If any of you, like me right now, I can feel it as I'm talking about this, I'm imagining it. My mouth is salivating. There's no time. I hate to tell you, there's no, I'm not paying for your trip. Sorry. You're not going on that beach, maybe not by me. And there's no lemon here. There is no lemon in our hand, but our body responds as if it is present. That's what we need to know. That's about our pain narratives. We keep our pain narratives going. So rather than having our mouth salivate to prepare for it, we're imagining the worst case scenario. So this speaks to something, and I don't like the language because it does sound judgmental, but in the pain research language, they talk about catastrophizing, pain catastrophe. We exaggerate our negative mental imagery, and it causes actual changes in our body that perpetuate the cycle. You know, if I just said, okay, you're on that beach and now you get sunburned, you're going to feel a different way. So there is something called the pain catastrophe scale, and it's really associated to our anxiety or fear. And when we talk about these different emotions, we could be in one or all of these. We could have fear about the pain. We could have fear that there's nothing we can do about it. We could fear chronic disability. We can fear the cause of the pain. We have anxiety about the pain. We can get angry and frustrated about it, even depressed because it might limit our ability. What we want to talk about with managing our pain is recognizing how much of that is in the future and how much of that is what we say catastrophizing. I'm not saying that pain doesn't limit us. It does. But remember that hardiness aspect. Are we only identifying about one aspect of our life? Lorimer Moseley. I love Lorimer Moseley. He's from Australia. That was my Australian accent there. Lorimer Moseley is a pain specialist, and he has 2 videos. If you ever get a chance to just look him up on YouTube, he talks about why things hurt. He talks about neurotags, and in his story, let me just tell you a little bit about his story. In his story, he was walking, I think he was going swimming. I can't remember now, but I think he was walking through the bush. He was going swimming, and he was getting to the watering hole. And what I do remember from his story is the next thing he knows, he woke up and he was in the hospital. He had been bitten by one of the most poisonous snakes in Australia. And if somebody didn't find him, he would have left him, he would have died. But he didn't feel anything. He didn't feel a snake bite. He doesn't recall how he got bit. So this speaks to our pain narratives, I'm trying to make the connection. So then one day he was hiking with his friends and they were walking and he felt sensory information. He got the sensation, went up to his brain. He felt something on his leg. And the next thing he knows, he was on the ground, grabbing his leg, screaming in pain. His friends all rush over and they look, and he just happened to get scratched by a twig on the trail. This is what happens with our pain narrative. Because his brain, he got bit by a snake. It didn't register as pain the first time, but now the brain knew something catastrophic did happen. He was bit by a snake. His body had a reaction. His brain and his memory system conditioned him to feel any similar situation to a snake bite as something harmful. And so he immediately grabbed his leg and collapsed. Anytime he would feel something, he became, again, without a judgment here, hypersensitive to the sensations. This is not faulting him. I don't want anyone else here faulting ourselves for feeling anything. But since then, what Lorimer Moseley will ask every single patient, and this is what I ask all my patients, regardless of pain or not, how safe do you feel in the world? That's a big question. And so he asks, when somebody has chronic pain, what in my life, my thoughts, my beliefs, my behaviors, my relationships, and this was pre-COVID, by the way, implies threat? And conversely, what in my life, my thoughts, my beliefs, my relationships implies safety? So a lot of my work with trauma, whether they have chronic physical or emotional pain, right? The brain doesn't register, by the way, the difference between physical and emotional pain. It's all in the same areas. So pain is pain. So let's stop talking about emotional or physical. It's just pain. Let's just say pain. What is safe? If we do not feel safe, we're going to feel more pain. When we do not feel safe, we activate the nervous system to try to get us out of that lack of safety. So think about that. If we're worrying about COVID, or we're worrying about an election, or we're worrying about the whatever we're worrying about, if we're worrying about what's going to happen to us 5 years from now, even, our brain sends a signal to the body as if it's happening right now. In no way does this mean don't plan, but what it means is we are rehearsing things and the body is activated. Just think about sleep. Does anybody have sleep issues? You don't have to raise your hand. I'll raise all my hands and my feet. I woke up at 3:30 this morning. And the first thing I noticed when I woke up is I was not in a negative mood, but I was thinking, oh, what do I have to do? What am I? When I think that, even if it was exciting, I'm activating the sympathetic nervous system. The sympathetic nervous system isn't just about fight or flight. It's about let's mobilize, let's do something. As a result of that, I'm going to have an impact on my pain. I'm going to feel the pain more too. So if I'm feeling like what's going to happen with my pain, I don't feel safe, I'm going to activate the nervous system and I'm going to feel more pain. I'm hoping this is helping you frame this idea of pain. In 1997, Johannesson had this typology of pain, and he called it two different things. He said we had either integrated pain, and that's just pain that's part of the real world. You know, I cleaned my deck, I moved my furniture, and I feel pain. And the thing about that is I didn't give it a meaning. My pain narrative didn't say, oh, this is the worst thing in the world. But with the advent of aspirin, does anybody remember the I think it was Bear Aspirin, Carly Simon's song, I Haven't Got Time for the Pain? I remember that commercial when I was younger. With pain treatments, it became naked that we have pain and it's this separate event and we should just get rid of it. So now we have this idea that if I have pain, something is wrong. And actually, that's not true. Pain is a normal response in life. Emotional pain, physical pain. Now, there's degrees of it, right? But it's a protection mechanism. So notice how you think of your pain. If you start to put it in a naked category, I feel pain, something bad is going to happen, you're activating your nervous system. Now, let's talk about a few specific techniques here. There's a book, and there's several books written by Joe Sarno. He was a orthopedic surgeon in New York City, and he did dozens and dozens and dozens of back surgeries, hundreds of back surgeries for people. And he would do a MRI. Some of you might have had a CAT scan or an MRI or an X-ray. And he would say, well, look, on the X-ray, on the MRI, their spine is shrunk and it's compressing a nerve. That's why they have pain. And then he would do the back surgery. There is a saying in medicine, almost all doctors say this: if you want to have chronic back pain, have back surgery. You know, because there is that aspect of that. Now, I know people from whom it helped. My mom had back surgery. It didn't do anything for her. But what Sarno then did is somebody said, well, why don't you take X-rays and MRIs of people who don't have back pain, same age, 30s, 40s, 50s, and he did. And lo and behold, people without pain had the same compression of their nerves, had shortening and disc bulging. And it's like, wait a minute. In the paradigm I have, if you have that, you will have pain. And he said, oh my gosh, they don't have pain. This revolutionized his treatment. He stopped doing most of his surgeries. Now, he said, granted, there are people. There's a number of people who really do benefit from the surgery. They need the surgery. Yet what he said was it's significantly less than he thought. What he did then is change all of this and said, what it's about is safety. He said, and so this slide just is a few of those surgeries and they've done or studies where they've looked at MRIs and CAT scans and found that people without symptoms there was just as many or almost as many people with compressions, bulging discs, and had no pain. So there is research and there's studies about this. Oh, this is about whiplash. I'll hold off on this one. There's studies about whiplash showing that in countries, I'll just say this now, in countries where they say to people, oh, you had a mild whiplash? Okay. Take 2 aspirin, see you next week. But what do we do in the United States? What do they do in Sweden and other countries? They say, this happened to me just last year. Oh, be careful for the next 72 hours. If you get a headache in the next 72 hours, if your back hurts in the next 72 hours, you might have whiplash. What did I just do? I created a pain narrative. Now I am becoming hypervigilant because I'm going, wait, did that tweak? Did that tweak? It was just like after my COVID shot. People say, well, your arm might be sore. And I was like, oh, is it sore? Is it sore now? Is it sore now? We're creating something, we're expecting something, and we become hypervigilant to it, and the body's nervous system gets activated. So Sarno was saying there's something else going on in your brain. Now, this is Moskowitz. He has a website called Neuroplastics, and he has a book you can buy. And he does the same work. He's like he's worked with dozens of people with chronic pain. And if you see this image, if you're looking at the screen on the right, you see there's a brain, a cross-section of the brain, and you see all these different parts of the brain light up. And that's exactly what we're talking about with neurotags. It's not just one area, your whole brain is lighting up. So it's a whole brain experience. But what he says also with your pain is that we rehearse these narratives. Sarno says this too. Sarno will tell you, oh, people will say, well, I was at the gym and I bent over and that's when I threw my back out. Sarno and Moskowitz say, what's happening is you don't feel safe in the world. There's some issue that you might not be dealing with. Now, they make it a little bit too simplistic for me sometimes. Oh, you're not dealing with your emotions. Sometimes Sarno said it that way. But there's something that you're not dealing with. But think about what I'm saying happens. If I'm really frustrated, upset, scared, unsafe in the world, my body naturally clenches. As a result of naturally clenching, I then bend over to pick something up, and of course a spasm happens. Of course it does. Rather than try to fix the problem, what Sarno says is, how do you fix the real issue? How do you address what's going on? Sarno would have you dialogue. Sarno will have you do things like write for 20 minutes every day about your deepest emotional issues. It's called automatic writing. And in Sarno, that's it. That's the technique. 20 minutes twice a day, just write nonstop. Don't stop writing. Just let your pen keep going and see what comes up. Because he was saying something wasn't expressed, and because you were suppressing it, you were tightening up. Now, with neuroplastics here, and the work of Moskowitz has been written in these 2 books by Norman Doidge, who talks about chronic pain, The Brain That Changes Itself and The Brain's Way of Healing. But Moskowitz will show everyone this image. This is acute pain. So you stub your toe, you cut your finger on a Ninja blender, and these areas of the brain will light up. But if you can look at the picture, you can see that they're just small little pinpoints of areas. This is from imaging of people with acute pain. But after days and weeks and months, actually, chronic pain, persistent pain, these light up even more because we rehearse it and rehearse it and rehearse it. So what Moskowitz does, so here's technique 2. Here's technique 2, and you can go to neuroplasticswithanx.com and the website, and he has these images you can download. He has people visualize. Remember, you just did visualization when you visualize being on that beach or a lemon. He has people, when they feel the pain, maybe it's in my knee, maybe it's in my back, maybe it's in my back and my knee, maybe it's in my back and my spine. Whenever you feel the pain, he has you imagine this is your brain. And then he has you imagine in your mind turning the dial down and turning it down to this. In your mind, you envision this. He has you look at these images so you get it in your head, and then eventually you turn it down to this. There are studies, I've done this with people, I've had people in chronic pain look at these images and imagine their brain goes from one to the other. And lo and behold, not everybody, some of you might say it's harder for you to visualize, it turns down the pain. Even if tissue damage is present or not present. So here's another skill. So what I hope you're getting so far is, what narrative do you have about the pain? What do you tell yourself about your pain? It's not saying that you're wrong or right. It's just notice how intensely you're practicing it. What is the imagery you have around it? What are you not expressing? And then the Lorimer Moseley's question is, how safe do you feel in the world? Now, all of that, the imagery is that attention modulation. You're focusing your attention on something else. Now, here's some studies about meditation, and there's images of the brains with the meditation, and you're all going to go, oh, pictures, okay. Yeah. Meditation, depending on the type of meditation, affects different parts of your brain. Meditation, if you focus on your breath, if you focus on loving kindness, 2 different types of meditation, that changes what parts of the brain get activated. So you can regulate your pain by shifting your attention. If you're at rest and you're focusing on your pain, then parts of your brain light up. But if you're meditating on the pain, you're just being present to it without any narrative about fixing it, the pain intensity can decrease. These are skills, by the way. So some other tips from Moskowitz is, rather than feel the pain and go, this is the worst thing in the world. How many of us do that? We feel a headache. And we tighten up. We activate the nervous system. From a meditation perspective, describe the sensation. Is it burning? Is it sticking? Is it stitching? Is it only in one area? And be present. This is a meditation technique. It's a mindfulness. Be present to the sensation versus feeding the narrative and fueling the narrative of going, oh, this is the worst thing that's happened. When is it going to get over? Did I do, what did I do wrong? Did I eat that? I shouldn't have done that. That's paying attention to the sensation and describing the sensation versus feeding that hungry ghost, as they say, and feeding that anxiety and fear. So that is an attention regulation. You are shifting your focus and your attention. Now, the emotional regulation can be, think of someone or something you love without question. This is one of my favorites. It's thinking of a memory of someone or something that's soothing. And right behind me, I don't know if you might not be able to see me, I just had one of my 3 cats walk right behind me. And I'm hoping my cat doesn't knock over one of my glassy babies. But that's one of the things I think about my cats that aren't damaging my house. And I notice that my heart feels different. My breathing changes when I feel that. This connects to the third thing that Moskowitz says, touch something. Many people with chronic pain can benefit by having an object, some nice cloth that they feel, stone. I have these right here, a very smooth stone that they feel that's cool, and that sensation, because neurologically, feeling the sensation of smooth, that tactile sensation, and the tension, this is cold now because it's just sitting there, it's cool. The cool and the smoothness are different nerve pathways than pain. There's something called the gate theory of pain, that if there's pain in a certain area, how many of you have done that? You know, you cut yourself and you rub it, you start to rub it. The reason rubbing it works is because that's a pressure sensation, and pressure is a different pathway than pain pathway, and it competes. So when you rub it and press it, not always, sometimes it makes it worse depending on what the trauma is, but when you rub it and press it, it will feel differently. Well, you can do this in general. You feel emotional or physical pain, feel something that's soothing to you. It's going to be a different pathway than your pain. Feel something that's cool. This is why they have things like icy hot. This is one of the reasons that people put ice or heat on. Not because ice is going to decrease inflammation. Yes, that's beneficial in some areas. But ice and that temperature pathways are different than pain. And it can soothe your pain. So touch is something you can do. And of course, another favorite of mine is essential oils. This is one called Centered. And smell, 2 synapses from the nose to the brain. That, and of course, if that's a smell I like, of course, not the smell of my cat's litter box, the smell of the essential oil. If I smelled that, it regulates my nervous system as well. So we can do all of this. And then the last one that Moskowitz mentions, and I'm going to stop, and I know we don't have that much time, but want to ask some questions, is humming, chanting. I really recommend people hum. People think I'm crazy. I've tried to do that in my office with people. I'm like, I'm not going to hum in your office. Like, there's no one else here. Hum. Especially the M sound. Because what it does is 2 things. When you breathe that way with the hum, and it's just a long hum, you're prolonging your out breath. When you prolong your out breath, you regulate something called the vagus nerve that slows your heart rate down. You don't have to think about your breathing. All you have to do is hum. Hum. And sustain it for a long time. Breathe in. Hum. The vibration also in the nostrils increases nasal nitric oxide, which actually opens up blood vessels. You can regulate your nervous system through humming. Now, if any of you chant, if any of you do the rosary of any sort, doing it even silently has been shown to regulate your breathing without thinking of it. And of course, if you're chanting something, the rosary or any prayer that is important to you, that can regulate your nervous system. So I'm trying to put these into perspective. This is a breath pacer. I'm gonna stop sharing there. If I hit the right button to stop sharing, it's right there. There we go. I know that's a lot, and I did provide some neuroscience stuff perspective. It's just trying to recap and say, wow, how am I, the word I use, orienting, how am I relating to my pain? Do I make it the only thing? I do. Just another little story, after my second COVID shot, I felt fine for 24 hours. I was saying to myself, I'm great. I'm not going to have a reaction. And then 24 hours later, fever, headache, terrible headache. And so what did I do? I did all these things to make the headache go away. I tried to breathe to make the headache go away. Wasn't working. I tried to do all these. And then all of a sudden I said, okay, wait, the headache is present. This headache and fever, see, I changed my narrative. It's a good sign. My body is working. It's working. I'm having this immunological reaction. I want, and all of a sudden I noticed that I released my tension. I didn't realize I was gripping my jaw. I didn't realize I was gripping my shoulders. I stayed in bed. I couldn't get out of bed for 24 hours, but I just laid there and I said, oh, I'm going to be better. And as I did that and I released my muscles and I just focused on letting myself feel the pain, the pain sensation didn't go away, but the intensity decreased and I was able to manage it. And then luckily 24 hours after that, it all went away. And it was like weird. But so I'm hoping this helps give you some perspective of like certain ways we can work with our experience. That's what I like to say, work with our experience and manage our pain. I'm wondering if you have any questions. I know we're almost at time. We're at time, but if there's any questions that anybody has, you could type in. And if not, that's great. Wow. No. And if you do have any questions at any time, my contact information is, you could always visit my website. It's thebreathspace.com, www.thebreathspace.com. I do guided meditations, free guided meditations every every Monday and Thursday at 8 a.m. On my website, you can go to the meditation page and it's a live stream at the moment. And I also have some other guided meditations on thank you for typing that in. What an easy thing. I could have just done that too. Thebreathspace.com. And you can always email me through there too if you have any other questions.
Great. Well, thank you so much, Brad. We'll see if any questions pop up as we're wrapping up here, but we just want to thank you so much. This was an incredibly informative presentation, and I think we all learned something very new about pain management. So thank you again, Dr. Brad.
You are so welcome. Thank you.
Let's see. Oh, we're just having thank yous coming into the chat box.
Nope. You are welcome. Yeah.
So after we're done here today, we're going to be emailing everybody a little survey. We'd love to hear your feedback on this Zoom event and any suggestions that you have for future Zoom events that we'll be hosting. And if you have any questions about University House Issaquah, the community, or you would like to come and take a tour, we are open for tours now. Feel free to reach out to us. Our phone number is 425-557-4200. And again, my name is Savannah Haverson. I'm the Community Relations Representative. Looks like we don't have any more questions popping up, so this will conclude our presentation today. Thank you again so much, Brad, and thank you all for attending.
Thank you all. Thank you all. Have a great day.
You too. All right. Bye-bye.